In higher stakes tasks, we should always keep in mind that there is tremendous risks, and we have to be very careful with integrating these type of tools.
The artificial intelligence model ChatGPT has taken the world by storm with its ability to write up just about anything you ask it. But what happens when something as important as the healthcare sector starts including it for medical writing and in-hospital care? Researchers from Saint-Justin and the Montreal Children's Hospital conducted a study in which they asked ChatGPT 20 medical questions. They found the chatbot provided answers of limited quality, including factual errors and fabricated references.
When we try to put everything together and look on the internet whether that study had actually been published, we realized that in over 70% of the cases, the references had been fabricated. It seemed real, but in fact, it was not.
Montreal researchers say it has the ability to both be dangerous and helpful and needs to be used with caution.
There's a risk of propagating misinformation and disinformation if we don't check our sources. We've seen that issue in many public debates over the last few years. So certainly tools like ChatGPT could exacerbate that issue. If you lose that transparency and the trust in scientific writing, that also erodes the trust of the public.
To test it out, I asked ChatGPT what the dangers were in using its platform in medicine. This is what it had to say. While ChatGPT and similar AI language models hold great potential for various industries, including medicine, there are several potential dangers and challenges associated with their use in this field, such as inaccurate or misleading information, lack of contextual understanding, legal and ethical concerns, over-reliance on AI, privacy and data security, bias and disparities, lack of accountability, dynamic and evolving field, loss of human interaction, and resistance from medical professionals.
In many cases, artificial intelligence can be a mirror of our society, right? Because especially in the case of large language models like ChatGPT, it is trained on massive amounts of data. We're talking billions of data points to train it so that it acts with such a humanness. But the accuracy behind it can suffer sometimes. In healthcare, I can think of a lot of areas where tools like this one can be used to make us more efficient and at the end of the day, provide more human care. Tools like that can help with some potentially automatable tasks that currently are taking hours of precious provider time.
In Montreal, Brittany Henriques, City News.